Have you ever noticed some unusual symptoms when you start to feel stressed? You might feel your heart racing, or feel abdominal cramps, or feel quite sweaty. So which of these responses are normal and what do they really mean?
I've been a doctor for more than 10 years and travelled the world extensively, and I've collected my top tips for you.
Start by answering, what is stress? Stress is the body's response to danger. Stress causes a flood of hormones that trigger the fight or flight response. This means that your body produces a natural physical response to stress. Your body is trying to work out whether or not it needs to run away or stay to fight. This was essential for human survival, especially when we had to hunt or gather food and stay away from predators. Some hormones your body produces as a result of stress include cortisol, epinephrine. So what are the physical effects of stress? Stress slows down some normal bodily functions. Things like your immune system is affected and your digestive tract is affected. It shifts its energy and resources to get ready to fight, so it concentrates its resources on increasing blood flow, alertness, and on your breathing. Common changes in response to stress on your body include changes in blood pressure or heart rate. Your breathing might speed up. Your muscles become more tense. You might suddenly feel more alert or more awake. One common way it affects me is my stomach. I suddenly feel quite tense and I notice a lot of abdominal cramps. And that's because stress affects your gut and your brain axis. When you're stressed, the chemicals that get triggered between your gut and your brain can trigger physical symptoms like diarrhea or constipation. A lot of people with autoimmune conditions also notice that they're affected by stress, and they might have an increase in their symptoms if they're feeling very stressed. What's one way of classifying stress? Different types of stress include acute stress or chronic stress. Acute stress is normally short-term and a lot more common. It might result because of recent events like a bereavement or a relationship breakdown, or if you're like me and you have a lot of exams, you might have acute stress. Chronic stress develops over a long period and is usually a lot more harmful. This could be due to lots of factors, work-related, home life, it could be health-related. With chronic stress, it can be hard for your body to return to a normal level of stress hormone. This over a long time can lead to heart complications or breathing complications. It could affect your sleep and your immune system. If you're feeling very stressed, it's important to seek to a doctor and we can give you specialist advice and maybe refer you onwards to get further support. What are some stress management techniques that I personally use? Well, I'm going to go through my top ones here for you. Exercise is something that really helps me. I try to do this on most days, even if it's involving a 30-minute walk, or my regular forms are yoga and Pilates. Reducing alcohol and caffeine intake. If I'm feeling particularly stressed, I try to limit the amount of caffeine I have because it can make me feel increasingly jittery if I have too much caffeine. Nutrition is another important one. I make sure I try to eat healthy. Even though when I'm stressed, my natural response is to eat a lot of sugar, I try to make sure I moderate how I'm eating so I don't feel worse as a result of my eating habits. I look at my calendar for the week ahead and I time block periods of relaxation. So I might say 2 to 6 on Saturday I relax, on 7 to 10 I relax on Sunday. So I try to use blocks of time blocked in the calendar for relaxation, and during that time I might read a book, I might have a bath, I might just watch a TV program. So I try to block off time and write rest in the calendar as a mental reminder that I need to slow down. Journaling, I try to write down everything that's stressing me out and look at it with perspective. So I make sure I look at the things which are most important and less important. So I start to prioritize my time and also why it's affecting me so much. I find that journaling really helps for me to see it visually and why it's affecting me. I also find my diary an essential tool, so I write down my to-do list and plan my time for it. If I have an exam, I make sure I prepare early for it, or if I have a deadline, I try to predict when I have to get the work done and how I'm going to do it. So I work backwards from the deadline. So I might see an event coming up, and then I think about all the steps that need to be done before then and how I'm going to do it and what are the actions that need to be done. I also remember that sometimes it's not possible to do everything really well, and there might be a week where I have to focus on family, or there might be a week where I have to focus on work. So I try to remember that it's impossible to do everything perfectly, and that's human and that's normal, and I need to maybe focus and choose on the things that are most important to me for that week. And hopefully perspective helps. If you're feeling stressed and you can step back and think to yourself, what of these things will be important to me in a year from now? It can help give you some perspective on where you should be prioritizing your time and your energy and what you'll be most proud of in a year's time. I hope you found these tips useful, and if you write down your favourite stress management techniques down below, I'll respond to them. Thank you for watching The Travelling Duck.